It's Zion here of Z Nature. So today I want to quickly discuss something called the varicose vein, or also spider veins. Okay, there are two types, right? So the spider vein and the varicose vein. I'm going to show you images first. Probably you've seen this happening to people or even yourself, because I've experienced this before, but thanks to Z Nature. First, this one, you can see this image here. This is spider vein. Okay, you can see how it is. It's not that thick or swollen like the varicose vein. You can see the spider vein. It's having different color, but this is just like a progressive stage. Like if you start experiencing this, it's likely you may experience this one that is so thick and swollen. Okay, I may show you other images soon, and it can affect anybody. It can affect males, it can affect women as well. Now, what is varicose vein? Now, varicose vein is when the vein, okay, first of all, what is your vein? Vein is like a pipe, okay, that supplies blood, that makes blood flow in your body. If you check your body, you see veins. These are kind of what vein, the ones your nurse would have to look for to give you injection. Now, that pipe that transports blood around your body, that circulates blood, that pipe, that connection, that wire all over your body, right, it's called the vein. Now, when this vein that supply blood all over your body becomes swollen, okay, it can be swollen, okay, it can also twist at the same time. That is what is called varicose vein. When this vein that supplies blood, this wire or pipe that supplies blood or that circulates blood around your body becomes swollen or enlarged, right, and twists at the same time, it can. So that is called varicose vein. And how does varicose vein form? Now, when there's something called valve, if you look at this screen, I'm going to open it. It has, like, let's call this the wire, right? This is your vein. Now, on top of this place where the cream will be coming out from when you press it, it's called valve, right? It ensures or controls how this cream, let's say your blood, will flow around your body. If you press this cream now, you see that it will start coming out from this place, because there's a control here. So also in your vein, your body, there is a control in that vein around your body that gives direction to where blood should flow to. Okay, it controls where blood should flow to. Now, if that valve or a tap, you know, when you open your tap, you close it, that control, when that control becomes weak, okay, it can lead to something called varicose vein. Okay, that thing that controls where blood flows to, it can lead to varicose vein when it is damaged, okay, or stretched, right? When it is damaged or stretched, when it is weak, maybe it's no longer working again, it is weak. Now, blood cannot flow to any direction. Imagine your blood that is supposed to flow to your heart is not flowing down to your leg instead of going to your heart. Okay, that is a problem. So instead of the blood to flow upward, it will no longer be able to flow upward. It can just flow anywhere. Why? Because the vein, they are weak, and a weakened vein can also affect the valve, that control. It cannot make the control not be able to function properly. Why? Because there's too much pressure now exerted on that valve. So it's two-way. It's either the valve is not working well, and then it affects the vein. The blood will not start storing on the vein. Imagine there's no place where the blood will flow to. I'm trying to make you understand this. There's no place where the blood can flow to. Okay, what happened is that it will stall, right? Imagine a tank that water cannot flow to. The water will remain in that tank. So when the blood cannot circulate through your veins, it will remain in your vein, and more will be coming in instead of going up, right? Instead of going up, it will be coming down, and it will cause pressure there that will make that vein to swollen, like make it, you know, enlarged. Why? Because there is too much pressure on that particular place where blood is not stored. Instead of that blood to be transported to other parts. Now, the law of gravity comes to play here. You know, when you throw something up, it has to come down. Now, when this valve cannot effectively push blood up to your chest, up to your heart, okay, it goes back. And that is why varicose vein affects the lower part of our body. It affects the leg, most especially your ankle, your knee, you understand, your leg area, essentially your lap, your legs. It affects this part of your body. Why? Because the pressure comes down. The blood cannot flow to the heart. The law of gravity, it has to not come down, and it will affect your leg. Now, it is worthy to know that whatsoever exact pressure around your abdomen, your tummy, it can also lead to something called varicose vein. Anything that exacts, that put pressure on your abdomen, your tummy, your stomach, it can result to varicose vein. It can set pressure on your legs and make that blood, not to circulate well, and that is a very dangerous thing. You see the reason why I always tell you, listen to me, like pay attention to me. Why? Because I'm interested in your health, what you eat as a nutritionist. Okay, that is why I also wrote the book, the detox therapy, which affects the gastrointestinal system, like your digestive system, from your mouth to your stomach to anywhere, okay, your esophagus and all. So anything that affects the abdomen, if it's exerting pressure there, it can lead to this thing called varicose vein. And example of such include pregnancy. You see why I'm interested in women? Because women, the number of people that experience varicose veins higher in women than in men when you compare, right? So pregnancy can lead to varicose vein. Constipation, when you cannot easily empty your bowels, you cannot easily go to the toilet freely, your physics is strong, you cannot very well, you cannot, so that can actually lead to varicose vein. You can see how your what happens in your stomach can affect your circulation, your blood circulation, and in another way can affect your skin. We'll also look at how the skin too can affect the varicose, the vein, okay, because the vein is stored where underneath the skin. Now, constipation, I said, can lead to varicose vein, can cause it. Pregnancy, when the fetus start forming in your tummy, okay, in pregnant women, it is noted that and they have more like high volume of blood, okay, than when they are not pregnant. Okay, as a woman, when you are pregnant, the blood in your body is higher than when you are not pregnant, because you are forming another human being in your body. So that high pressure, that high volume of pressure in your body, the way it's going to be circulating, can lead to high pressure, which can be exerted on your vein, because the vein is the one carrying and transporting this blood, this high volume of blood, and the vein can become a bit weak while doing this, right? And that can lead to varicose vein. Another thing again is your hormonal changes during pregnancy, okay, can lead to varicose vein. Talking about the hormonal imbalances that occur during pregnancy, which can cause this varicose vein. Now, when there is something called hormonal imbalance, okay, it can lead to the veins in the body to relax. These veins are supposed to be doing this work, this hard work, to not relax, to be sleeping instead of working. Why? Because of hormonal imbalance. Okay, trying to shift my chair. Because of hormonal imbalance, okay, it can affect, okay, the veins, because the veins will not be relaxed. Instead of transporting blood, it will not be very slow in transporting blood, and that can exert pressure on the veins, right? So another thing again during pregnancy is when the fetus, like the baby, is forming, it's getting large, okay, anything that exerts pressure on the abdomen can cause this varicose vein, can make the veins weak, okay, can make even the valve of the veins weak, okay, which can lead to the varicose vein. Now, it can exert pressure on the pelvic muscles. I know the pelvic muscles is below, is under, and that weight can affect the legs, the veins around the legs region, and then you can see something called varicose vein. Also tumors in the abdomen. Okay, I said anything that exert pressure around the abdomen, fibroids, tumor, those things can also lead to what? Varicose vein. As I've made mention of constipation, you need to look at your diet, you need to do the detox and water therapy so you can easily flush out this waste. There's something called the chronic venous insufficiency. Okay, this occurs when the skin, okay, cannot properly receive oxygen, nutrients, and waste, like exchange waste with the blood. I tell you, anything you are applying on your skin can affect anything on your body, can affect your vein. Remember, the veins are stored underneath your skin. The veins are there, it's under your skin, you can see it. So when the skin is weak, especially when you start bleaching your skin, when the skin is weak, imagine the vein can be weak as well. Have you taken note of that? Because doctors are saying for some cases they may not know what caused the varicose vein, like actually, like the vein just get weak. It may be what you're applying on your skin which can affect the vein. Imagine your skin can develop stretch mark, can become weak. What about the vein? It can be weak as well when you bleach your skin, because we've had clients, you know, that have damaged skin from bleaching, and over time when they are able to build their skin back, you see those green veins, those spider veins, and even varicose vein, especially the minor one, they start clearing out when they start using our products. They bought the body kits, they bought some skin repair products, and over time it starts, you know, their skin barrier formed, their skin became thin, and that also affected the veins to become strong, and the skin was restructured. That is what we call skin restructuring, from beneath to the outward. Everything was restructured. I'm also a living proof of this. I used to have two on my legs, both legs at the back and one at this side, and right now there is nothing there, like everything vanished. This varicose vein vanished. It was greenish kind of in color and purplish. Some persons, it can take the color of the skin, the varicose vein. The spider vein can become reddish because of the blood vessels, right? It can be greenish, it can be purplish, it can come in various colors. It can be kind of dark or so. It can leave a kind of discoloration on your skin, right? So you see, this thing also boils down to the skin. Imagine your skin cannot properly, you know, release waste. You know, we sweat, you know, to release waste. Even the oxygen, we have holes on our skin, and you know, your skin cannot exchange the nutrients inside the blood, right? It cannot affect your skin. Sometimes you may be treating something else, not knowing that your skin is not absorbing nutrients from within, because the blood, as the vein is flowing, it will also affect the skin. It has to, there has to be exchange, okay, something called you know, osmosis, right? You know, being able to exchange with the environment, the blood vessel or the veins and the skin. So when it's not able to do this, it results to something called chronic venous insufficiency. No sufficient nutrients and oxygen or release of waste with the skin and the blood, and that can make the vein weak, all right, because the blood flow is restricted, it's no longer active. Okay, now what are other things that can make people develop this varicose vein, apart from others we've mentioned? Obesity. When you are overweight, you see why I'm interested in you being fit, you know, having healthy weight. When you are obese, it can be also from family history, like hereditary. You can experience this varicose vein. Your diet, constipation, like I've said before, can make you prone to varicose vein. Aging as well. When you are between 50 and above, you may be prone to experiencing this varicose vein. Okay, we also talk about when you are not active, like you don't exercise, all right, you're always in one place, sedentary lifestyle. You see why you need to listen to me, get my courses, sign up for my programs, 30 days fitness challenges, my ebooks, and all you have to read. So you need all this to prevent all these things. I've not really gone deep yet about what varicose vein can cause. We're only looking at, oh, probably you don't like how it is showing on your skin. Okay, also we have other causes, like if you sit for too long, your nature of job can make you sit for too long, and that can make you experience varicose vein. If you also stand for too long, you know, too much of everything is bad. So when you stand for too long, you can also experience this varicose vein. I don't know if you're an usher, you stand for too long, your legs, it can exert too much pressure there. If you sit for too long, you can also experience this varicose vein or spider vein. So you need to be active. If you sit for too long in the office, move around, go out, do squats, you know, just climb through the staircase and come back. If you are standing for too long, try and move around or sit down a bit. You know, these are the things that can help you, right? And these are some risk factors that can make you have varicose vein, and you know, you have to do the opposite of this risk factors so you don't experience this varicose vein. Okay, so now how can you treat varicose veins? If you don't treat varicose vein, it can pose danger, okay, on you, on your health. Imagine your blood cannot flow properly around your body. What can that lead to? High blood pressure, or is it low blood pressure? Yes, low blood pressure can kill too, as well as the way high blood pressure can kill. Another thing again is when this blood are not flowing properly, it can form clots. The blood will now form lumps instead of it flowing, something that is stored in one place. What will happen? It can form clots, and over time the blood can, you know, still flow up, and that clots that are formed, like a stone or something that is thick that are formed, it cannot flow to your lungs. It can get to your lungs. That thing forming like obstacle now can get to your lungs or your heart, and that can, you know, cause havoc on your head. Imagine you cannot breathe properly, that person can die. Or it gets to your heart, it blocks any pulmonary arteries, okay? And you know, that can lead to heart attack because the blood cannot flow well around your heart. You know, the heart is everything, so you want to prevent that. Also, if the blood or the pressure being exerted on your vein is becoming too much, that vein can burst. And when your vein bursts, that is emergency. Like blood is now leaking all over your body. It's no longer flowing through that pipe. Do you see what that is causing? It can lead to something just like fuel that is passing through a pipe, and the fuel, the pipe bursts, the fuel escalates. What happened? It will cause havoc. So that is very bad, and so that's why you want to, you know, treat the varicose vein. Some person may like, oh, it's just there, I'm not feeling any pain. But well, if it is getting worse, you may want to treat it or do preventive measure at least to reduce it getting worse. Okay, some persons can experience symptoms of this varicose vein. Some persons may not even experience symptoms at all, but they can just wake up one morning and see that they're having veins that are getting swollen. What are the symptoms that you may experience if you are developing varicose vein? Okay, one is probably your ankles, like your ankles are swollen. Okay, that can occur in pregnant women. You know, sometimes people who are pregnant, when they experience this varicose vein, after they give birth, it can just go off. Some persons it may remain there, some persons can reduce, but it will still leave that swollenness there, or the mark or the discoloration on their skin. And some persons will also want to treat it off after they might have, you know, given birth. Okay, so you can experience swollen ankles, you can experience heaviness around your legs or your leg in general. Maybe after you exercise, or probably you just take a little walk, you see that your legs are heavy. Okay, or when you are sleeping, you feel like there's heaviness in your leg. Sometimes you can experience this cramp, you know, or muscle pull. You are frequently experiencing muscle pull. Maybe you are sleeping, or you decide to raise your leg in the morning or come down, your legs are tight. Yeah, it's like you know that feel. I've experienced that before. You know, you cannot move your leg, it's just there and stiff, right? That can be a signal that something is wrong with your veins. Your bloods are not circulating properly. Sometimes if you have injury around your leg and the bleeding does not stop on time, it keeps bleeding than normal, it may be that you are at a risk. It's a symptom that your blood may not be flowing well, or your veins are weak. Okay, and you want to do something about it, right? There's also something called the aching leg syndrome or restless leg syndrome. Your legs are aching you, or your legs are restless. That's if something is moving your leg, like it's just there, or your leg is aching you. That may be a symptom of you having a weak valve or weak vein, which may result in varicose vein, or you know, the slightest one, which is the spider vein. Okay, we also have other symptoms, okay, like something called the lipodermatosclerosis. Okay, this occurs when the fat stored underneath the skin, especially around your leg region, becomes thick or stiffened or hardened. The fat, you know, we have fat stored underneath our skin. Now when that fat, especially around your leg, becomes very thick, or you can experience it around the ankle, which will make your skin squeeze. You see that your skin is now squeezed or shrink. That is called lipodermatosclerosis, and that can be a symptom that your veins are weak, your valves are weak, and you may experience something called varicose vein. Now there are different ways you may want to treat varicose vein, but people who have used probably surgeries, radiotherapy, sclerotherapy, whereby they inject a chemical to help a bit kind of strengthen the veins and make the blood, you know, lighter to flow and all of that. You know, people go for all this. It's not sustainable. They keep going for it, you know, over time, because the thing can still come back. The varicose vein can still come back. Not that it won't clear fully like that. You know, people go for surgery, different, you know, different treatment for it, you know, where you can see a doctor and they can tell you what to do. They can decide, okay, you need surgery for this, or even laser therapy. You know, they can do some laser therapy, especially for the spider vein, not like the varicose vein that is already swollen, and that can ease the pressure. So there are different methods they can use to help the veins, you know, help transport blood and make the swollenness reduce a bit. Some things you can do, like I said, you can start exercising so that your blood can flow. As you are getting active, your blood can easily flow around your body. Okay, so you want to do that. Then when it comes to the skin, like I said, preventive measures: use natural skincare products like Z Nature. Stop bleaching your skin, stop damaging your skin. That was the reason why we developed this product called the rice enzyme concentrate for damaged skin. I don't know if you can see that. Oh, for damaged skin, okay, maybe you can see that. For damaged skin, rice enzyme concentrate. This product, we put it out because we had clients that are, you know, experiencing damaged skin, varicose veins, spider vein, green vein, because they've damaged their skin barriers with bleaching products, right, which has also affected their veins. So our black soap is there. Some persons started using it and it actually helped them. But those ones that had chronic damaged skin, we have to formulate this formula, okay, and this can also be used if you have cellulite on your legs or your body, your skin in general. It can restructure your skin effectively. If you have bleached your skin, this is what you need. If you are experiencing varicose veins, there are ways you combine it, like our brightening body scrub. This one is also serving like a kind of dermabrasion, you know, the laser and all. So that insect, you scrub, you apply your cream. You also have the spot remover for those ones that forms discoloration, the varicose vein that forms discoloration. You may need this one. So it just comes as a kit. And the treatment soap, this one is always a side chick, so, and that can really help you with time. You see that it will just vanish. And of course you want to come for consultation, because this varicose vein is not just caused by bleaching products or damaged skin. Like I told you, it can be caused by various factors, and that is why having a consultation with us is very important. We will look into your lifestyle, your activity level, probably if you need some exercise that will help you, your abdominal health. You know, you may want to get our detox therapy. We'll look into that. And consultation is currently free. Online consultation, we charge 5,000 naira, and one-on-one consultation to see me or any of our consultants is 10,000 naira. But now you can get it for free. And our products, you can get any of these kits 20% off this month on the 10th and on the 11th, which is tomorrow and next tomorrow. If you are seeing this video, okay, you can get them at 20% discount. Okay, remember, prevention is far safer, far cheaper, and better than cure. You want to prevent this. If you're already having these symptoms I've said earlier, you can reach out to me and I can ask you some questions and find out what you can change in your lifestyle, or what may be the predisposing factor that may be leading to such, or why you are experiencing such symptoms, and what you can do to prevent the varicose vein itself from forming or to become blown, fully blown. Remember, it can lead to a heart attack. Your blood may not be circulating well, your nutrients may not be circulating well around your body, and that can lead to a lot or complications. Okay, can lead to complications in your health. You want to prevent that, right? So Z Nature is there for you. I'm here for you. Your skin, your diet, your nutrition, okay, and your fitness as well, your lifestyle as a whole. Remember, when we talk about skincare, we look at it holistically. Okay, that is why consultation is very important and paramount. All right, so thank you so much. Until I come your way again next time. All right, I'll be talking subsequently on other topics. I hope you gained something from this brief lecture on varicose veins and spider veins. All right, so if you are experiencing any of this, please reach out to us, get a consultation, get our treatment kit, and probably changes to your lifestyle. I remain Zaun Lilinfo. Catch you